Previously on Weathering the Storm.
The key to really preserving Singapore's capacity and making use of our existing resources really involved us being able to efficiently manage the existing patients in the system.
We ensure that there's adequate community care facilities and community recovery facilities to house the recovery COVID-positive patients. We have to liaise with various agencies to make sure that facilities are set up. And these facilities could be from a variety of places, could be schools, could be SAF camps.
Your entire focus is on providing primary health care to the 1,800 patients at any time. This by far is the defining moment of my career. It's a national crisis.
From April to August 2020, more than 50,000 migrant workers living in dorms were tested COVID positive. The battle against the virus was far from over as waves of COVID infections continued to attack the heart of our healthcare system. At that rate of infection, it would have been a matter of weeks before Singapore's hospital beds would be full.
An effective strategy in combating COVID-19 actually requires the healthcare system to be very efficient. We need to make sure every COVID patient receives healthcare in a very prompt manner and recover from COVID-19.
To manage the surge in COVID-19 cases, many organizations and agencies, including MINDEF-related organizations, joined hands to swiftly repurpose several large developments, such as the Singapore Expo, Changi Exhibition Centre and the National Service Resort and Country Club, Kranji, into temporary, robust community care facilities to house patients who were recovering or had mild COVID-19 symptoms.
The key challenge in any situation like this is really the need to coordinate across the ministries. When you come down to the CEC, it's exactly that, you see. The CEC is an exhibition centre and you have to transform the entire place from an exhibition centre into a dormitory. That's no mean feat. These require inter-ministry work, discussions, agreements, some compromises to make sure that we can get it up on record time.
I think the success of the operation was really because of a strong team, different people coming on board, and we tried to optimize their skills and expertise to the best of our abilities.
This is a dedicated team, so they will be focused on a rostered basis to come and support the operations for as long as we need to.
We were responsible for working together with our medical services provider to look at the various medical infrastructure, medical protocols, processes that have been in place.
It started off putting in all the beds, bed frames, getting all the lockers, cleaning equipments, packing welcome packs for every one of them. Subsequently, we work with the housekeeping to ensure that the place is clean all the time.
We actually have a patient experience journey to ensure that we give the best service that we can for them. All in all is to ensure that we fulfill the intent that our patients have a good road to recovery as well. We took to the drawing board how their experience from arriving to the CEC all the way to the discharge, how they are being welcomed, come into the facility to do their check-in registration, all the way to having a video introduction to the facilities, subsequently checking into their rooms.
The role we play involves our staff unloading the food meals from the vendor, bring it to the food chamber where the exchanges take place between human and robots. So we will always try to make sure that the variety is there so that they have a choice of different cuisine and make sure that the quality was acceptable.
We are in charge of electrical power and Wi-Fi for them to be able to connect online to watch some shows while they are in the site, and also to connect back home to speak to their families or anybody else they need to connect to.
So we had to come up with a plan to ensure that the waste is disposed of. We're very fortunate to have consultants from MINDEF, DESTA, and also we liaise closely with PUB for support, setting up the portable toilets, building the pipes, constructing the pipes, and then ensuring that the wastes are removed. So we had to bring in a sewage treatment plant to treat the sewage on the spot and then let it out into the sea.
All the sanitation water, the used water from the sanitation site, would come to one collection point, a sewage collection point, and from there to collect the sewage, to reclaim the sewage, to treat it, to disinfect it to a level where it is good enough to discharge into the water networks and ultimately go to the sea. This particular treatment system is quite sophisticated, and that the system never stops.
So what we're doing is we're also trying to leverage on technology to help us in the operations and the outreach to the patients. So with teleconsultation, we're able to see more patients. The ability to scale up as and when necessary is much more efficient than a physical doctor on site. In instances where the patients may feel lonely or even depressed, they can always go to the teleconsult stations to reach out to our doctors.
The idea is to provide another added level of sanitization so that we are able to make sure that the place is as clean as it can be. The UV robot basically helps to kill germs, right, to emitting nanometers of light rays to kill the viruses. What's interesting about this robot is that it do not need people to automate it. Basically, the UV uses our autonomous robot platform that it can be operated without people within the environment. So in itself, it keeps people safe and minimize people in so-called red zones as well, or yellow zones as well. For the food robot, the carts are permanently fixed onto our robot. The idea is to increase the efficiency instead of pick and drop. So this is some of the improvements that we make along the way as we basically understand the workflow better and how we serve the residents better.
Having the tent providing solar energy for a good portion of the entire facilities is a very sustainable way to go. When we design the tents and we design the partitions, we allow for land breeze, sea breeze, natural circulation, natural flow. And I think the ability to also reduce the generator sets allows for lower noise, therefore leading to more comfort for our patients.